Joining us now, Dr. NK Arora, Chief of India's COVID Working Group. Thank you very much indeed for speaking with NDTV. Dr. Arora, let me begin by asking you, this WHO report, it's come up with a staggering number, 9 times India's official estimates. India, of course, disagreeing with the methodology. Can you explain to us why India is uncomfortable with these numbers?
India is just not uncomfortable because these are untenable figures. In fact, in your report, you have shown that in 2020, 81 lakh deaths were reported overall in the country as far as CRS is concerned. And these 81, and if we go by WHO estimates, that gives us that almost 25% of deaths in India in that year were because of COVID. That's what it shows. It's about 20 lakhs. That's what it is showing, that 47 lakhs in 2 years. So about 20 lakhs in the 2020.
But Dr. Arora, even those CRS figures that you refer to are talking about, over 3 lakh unexplained deaths.
I'm coming to that, and I hope you will allow me to give you some figures. In 2018, 5 lakh extra deaths were reported by CRS over 2017. In 2019, 7 lakh deaths were excess over 2018. In 2020, 5 lakhs, 4.6 lakhs, as you said. I'm putting in rounded figures. 5 lakhs deaths excess over 2019. Now, what does that mean? Over the years, gradually, CRS coverage of deaths is improving. And now we are over 98, 99% of all the expected deaths are covered by CRS. CRS is a decades-old system. It's a very robust system. And over the years, it has improved. It is not a system which has been put up in last 1 decade or so. It is for several decades it is there. And during last 7-8 years, gradually the number of deaths are increasing, although the population is increasing. So there may be some excess deaths because of the increasing population. But we also know that there is improved average age of Indians is increasing. Third dimension is that along with increasing age, increasing health system, the most important thing which is happening is that CRS performance is improving. They were able to, in 2018, it was around 85, 88% deaths were covered. And by 2020, it is now 98, 99% deaths covered. So every year there is increase, because between 2018 and 19, 7 lakh additional deaths. Do we say that they are all COVID? Because
okay,
COVID was
so Dr. Arora, if I may, respectfully.
So what I'm saying is that in 2020, we don't have 21 data, and very soon it will come, that will also be public domain. But out of the excess of about 4.6 lakh, 1.45 was the reported deaths. So those 3 lakh deaths, there are other deaths are also, and our death comparison is also. Let us say all 4 lakh were extra. Even then, it does not fit into the WHO estimates. But preposterous. So what I am trying to say is there may be missing of some deaths. 5, 10, 15% deaths are obviously not everything is recorded. But the way WHO has put us in tier 2 countries where no data is available, where modeling and estimates are done, whereas we as India has very robust CRS system.
Right. So you're objecting to the classification in tier 2 also, Dr. Arora, and we take that as a valid point. But what do you say to those critics who are saying that, COVID deaths have been underestimated? We're not going by how many deaths it's been underestimated by, but because of sort of compensation reasons that states perhaps are not reporting to the center accurately either. Would you say that there could be some lag there?
So there was lag, and after Supreme Court ruling, and there has been kind of last 6 to 8 months, every state has been putting up these extra death numbers which were missed out in the previous ones, and now they are all part of the current system. So many times, even in states like Kerala and the other very well performing states, additional deaths have been added up into the recent numbers. So it's a huge country. So there would be some missing, but it is not that we are talking about 10 times higher, which the other thing is, if it was so much, then people should have swam after WHO, because the Indian definition of COVID death is any death occurring within 1 month of being diagnosed as COVID. Nothing much has happened. People have been coming and compensation is being paid out, but there is nothing like 40 lakh people have not come in. Otherwise, they should have come in if they were all dying because of the COVID. So there are several inconsistencies, and I will also put one other important point. See, India has managed with COVID, which is 1.9 billion doses distributed vaccines and a very good management. Well, everybody has to accept this is one of the finest platform, IT platform. We can manage that. We have a great platform for managing RT-PCR and RAT tests across the country. Mm-hmm. Then our own death data to say that it is not reliable and putting us in tier 2, I think one has to see that this is not correct. This is very unfortunate that WHO has done something of that kind. And I think a time has come that we say this is what is the truth.
Okay,
and
fair enough. Dr. Arora, let me put it to you in this way, that, we saw hospitals being overwhelmed. We saw many people not being able to take COVID tests at the time. And so therefore, there were some deaths that were registered as not COVID deaths. So that might in fact account for some of the discrepancies. But also apart from that, just given the overwhelming number of deaths, perhaps, is it fair to suggest that the registration systems also couldn't keep up in the same way that labs couldn't keep up and hospitals couldn't keep up?
See, Ankita, as I said, we have death registration is a very robust system. I think to start doubting, then everything,
given the circumstances, Dr. Arora, I absolutely take your point about the death registration system being completely robust in normal times. But these were not normal times.
Even in this time, when we are saying that from year to year, there has been increase in the registration of deaths. That means system is improving. We will say, okay, the system is not improving. Even then, I am saying that the excess deaths were 4.6, out of which 1.45 has been said. And I think there is no harm in saying that 10 to 15% deaths or up to 20% deaths may have been missed, but nothing like what WHO is saying. That does not fit into any kind of And in fact, if we look at the death per million, India is one of the lowest. You talk to any corporate hospital, you talk to any government hospital, we have around 372 deaths per million as compared to 3,000 or 2,000 plus deaths per million in most of the high income countries. Our doctors have managed the way overall there are other reasons also why the pandemic is likely to have less impact on us. We also know many very celebrated journals across in 2020 they predicted a doom for us. In 21 they said we will take 5 years to 25 years to immunize our 1 billion population. I think they have all been proven wrong. And even this, I would say, that we should really be worried that why such a kind of a statement has been made, which doesn't stand on any kind of logic or fact.
Dr. Arora, thank you so much for joining us on the show.